Hello, how are
Hello,
you? Is
I'm
it
fine.
is it Mr. Elliot Jones?
Yes, the same.
Hi, Mr. Elliot. I'm Dr. Yasmin. I'm one of the junior doctors here in GP surgery. Could you confirm your age for me, please?
I'm 62 years old, doctor.
All right, Mr. Jones. How can I help you today?
Actually, doctor, I had a lesion like from in my head, and my wife said to me I should ask for medical help for this lesion.
Okay, so you noticed a skin lesion on your head. Where exactly is it? Is it on your face?
Yes,
All right, and have you noticed any other lesions all over your body?
no, nothing.
Okay, and when exactly did you notice it?
I think 6 months ago.
Okay, 6 months ago. And has it been growing in size?
No, I think it's the same, but recently I noticed it's get a little bit red,
Okay.
and also there is some yellowish discharge.
Okay, so yellowish discharge when you squeeze it or when you touch it?
Yes, a little bit on touch.
Okay, and is it painful?
I think no.
Okay. Is it raised on your skin or the same level?
I think it's the same level, but it started to increase in size.
Okay. And is it bleeding on touch?
Yes, yes, actually, yes.
Okay. And what about the borders? Is it regular? Is it irregular?
Actually, I think it's irregular.
Okay. Okay. And there are no other lesions, only this one on your face.
Yes, doctor.
All right, Mr. Jones. Just a couple more questions to get to know better about your condition. Have you been noticing any weight loss recently?
Actually, my clothes is a little bit um, larger for me now.
Okay,
I
so
think yes, I have lost some weight.
okay. Could you quantify the weight? Do you know how much exactly have you lost?
I don't know, maybe 5 to 6 kilos.
Okay, and they were unintentional. You weren't on a diet or anything.
No, nothing.
Okay. Are you feverish?
No, I don't think so.
Okay, so generally you're feeling fine, not tired.
A little bit tired, yes, these days.
Okay, all right, Mr. Jones. What about, is there anything else associated symptoms with this?
Actually, nothing, but I am a little bit worried now because it's it's bigger, as I told you, much bigger than
Okay,
before,
yes,
and
okay.
it's of a different colors.
Okay, so it's not the same color as your skin. Is it pigmented? Like, is it more darker?
Yes, some parts is more dark and some is more light. It's not of the same color.
Okay, all right, Mr. Jones. I understand that this can be worrying for you, and I'll try my best today to get to the bottom of this with you right now. Just a couple more questions about your general medical health.
Yeah,
Are
of course.
you, yeah, thank you. Are you currently suffering from any other medical conditions? Do you have diabetes, hypertension?
No, nothing.
Okay, and are you taking any medications?
No,
Okay, any allergies at all?
no, nothing.
Okay, and what is it that you do for a living?
Actually, I am retired now, but I
Okay,
used to work in China for like 3 years or something.
okay, and
Outdoors working.
oh, okay, and you've been subjected to the sun a lot?
Yes, I think so. All my
Alright,
work was in the sun.
okay. And how about your diet? Are you generally eating healthy?
Yes, actually, yes,
Okay. And do you smoke?
yes.
How many cigarettes a day?
About 20.
Okay. Are you considering stopping smoking?
Actually, I tried a lot, doctor, but I failed every time.
Okay, so we really do have a very good smoking cessation clinic. If you are interested in that, we could also talk about that later on. Um, how about your drinking? Do you drink?
No.
Okay, so Mr. Jones, thank you for answering my questions. Do you have any idea what might be going on right now? What might be causing this?
Actually, I'm not sure about what may be the cause behind this, but my wife was very worried about this lesion, so
Yeah.
I came to seek help.
Okay, I understand that. And is there anything else concerning you?
No, nothing. I would like to ask you, doctor, what do you think it may be?
Okay, first I'd like to check do some examination first to be sure, and then we'll discuss the condition together. Is that going to be okay?
Yes, of course. Stomach examination, all normal, and
Okay.
I would give you a picture of squamous cell carcinoma.
Okay. So, Mr. Jones, after hearing your history and after examining you, I now suspect that unfortunately you might be having a condition that we call squamous cell carcinoma. Are you aware of this condition?
I think no, but what do you mean, doctor? You mean it's a cancer?
Unfortunately, yes, squamous cell carcinoma is cancer of the skin, but I can't tell for sure right now because we have to do a biopsy first to take a skin sample and examine it to make sure. But for now, yes, given the history that you told me that it's irregular and bleeding on touch. All of this history points us towards something that could be sinister. I'm sorry to tell you that. So we have to rule that out. We have to make sure that if it's right or not. Okay.
Okay, but what I have to do now, doctor?
Well, for now, I'd like to refer you urgently to dermatology, where they will take the skin biopsy as we discussed right now. And just keep in mind that not everyone who is referred for cancer comes back with the results of cancer, but this is a serious condition that we have to rule out first. And after that, we can seek management. So right now, I'd like to refer you to dermatology, and if the squamous cell carcinoma is confirmed, then we can discuss. There are management plans. There are treatment for this, and we will discuss it with you. But first, we have to confirm it. Is that going to be okay with you?
Yes, yes, of course, but do you think it's a treatable condition?
Yes, squamous cell carcinoma, if confirmed, there are many treatment options like radiotherapy and chemotherapy, and it generally has good prognosis if catched early.
Okay, so
Okay, Mr. Jones. For now, I'll do the referral, and I'll also give you a leaflet about squamous cell carcinoma to get you to know better about this condition. And if you notice any changes, any more changes in the lesion, or if you're feeling really tired or losing more weight, you have to come back here as soon as possible so we can examine you again. Or if the letter for the appointment hasn't reached you in 2 weeks period, then please come back to for another referral. Is that all right?
yeah, doctor, I think I can do that.
Okay. Do you have any more questions, Mr. Jones? Is there anything else that I can do for you?
No, nothing, but do I have to tell my wife about this, or it's
Yeah,
what I
it's
have to do
it.
now at home?
Well, so you're living with your wife. Do you have like good support? Are you going to
Yes,
be
I
able to
think
handle
yes,
it well?
she's really supporting me.
Okay, yeah. For now, I suggest that you can tell her about the what I told you today. It's always good to have someone go with you in these situations to support you. And
Yes.
Yes, so but until now, as I told you, the condition is not confirmed. The diagnosis is not confirmed. It will be confirmed or not after the biopsy.
Okay, doctor.
Okay.
I understand.
Okay, Mr. Jones. Anything else that I can do for you?
No, thank you, doctor.
Okay, Mr. Jones, have a good day. Thank you.
Hi, Dr. Yasmin. Thank you so much for sending your one-to-one practice with Dr. Nermeen. So overall, the session was okay. The only thing I noticed that it was around 10 and a half minutes. So just like we need to be aware that in the exam shouldn't be exceeding more than 8 minutes. Okay, so that's a fair thing. So positive things from listening to your consultation. You greeted the patient the right way. You confirmed the patient's name and date of birth, which is very important. When you started asking the patient about the skin lesion and she mentioned that she's got skin lesion, I would appreciate if you tell the patient, please, can you tell me a little bit more about the skin lesion? All right. That's very important because basically you give the patient a chance to explain what kind of skin lesion have they got. They might actually tell you the size of the skin lesions. They might tell you how big is it, when did they start noticing it. Okay, so it's very important to let the patient speak. So that's what we call golden minute. So let the patient speak, give them the opportunity to elaborate. So ask them, can you tell me a little bit more about that? Because basically, in very easy words, the patient might actually tell you everything you need without even you asking them about. So after that, you did really very well by exploring size, shape of the skin lesion. Has it gone any bigger? Any oozing, any discharge, any bleeding, and how about the borders, which is absolutely fine. When it comes to the psychosocial aspect, so it was like really good. The only comment I have here, because basically you ask the patient at last at the end of the station about whom do you live with. Probably it can be actually like relevant, which is absolutely fine. But my point here is when you mentioned do you feel supported at home, probably they might not be very relevant in here. So very important to keep that in your mind. You can ask about psychosocial history, but it's only when it's really relevant to the station. Perfect. When it comes to eyes, you did really well. You asked about the concerns, but very important as well to ask about the patient's expectation. It's very important. Okay, so what are you hoping from our today's consultation? That's very important. When you started speaking about the diagnosis, the suspected SCC, that was really fine. You're actually telling the patient what your thoughts are, which is absolutely fine. Try still, because like I said before, you are an FY2 doctor, try please to include the senior in your consultation doctor, because basically, like I said, you're an FY2 doctor, you're expected to be in a basic level. But again, that doesn't mean that you have to tell the patient, I'm not sure, I'm going to communicate with my senior. Okay, so very important to be confident about what your thoughts are, but again, try to include the senior. So you can say, but I might also discuss that with my senior at some point. Okay, if the patient, if you do suspect they have got a diagnosis, whatever the diagnosis is, so please always ask them whether they are happy to hear about their diagnosis or not. Okay, because some patients do not really like to be told about their diagnosis. Right. Again, important whenever you're actually not breaking bad news in here, but again, at least you're telling the patient that they might have got cancer. Very important to try to be empathetic. You were actually empathetic, but I mean, I would appreciate if the tone of voice acts as if you're actually like really, really concerned about the patient, and again, you really appreciate that she might be concerned. So you can say, so like for example, Mr. Jones, actually based on the symptoms that you've told me and based on my examination, the best case scenario, it could have been something simple, but again, I don't want to miss anything sinister. And by sinister, I mean, unfortunately, cancer. So, but again, that doesn't mean anything at all. However, the best way to confirm it's not cancer is actually to refer you into a skin specialist. Okay? So, dermatology, please do not say, you can say dermatology, but again, you can still explain what dermatology means. Okay? Because basically, try to make your words with a patient as simple as possible, all right, as layman language as possible. Again, so the management plan, always please try to make it a two-way conversation. Include the patient in the management plan. How do you think about that? Are we on the same page? All right, okay. Have you got any questions for myself? So all of these, you shouldn't be actually telling these sort of phrases after every single part of your management plan, but just like at least you should tell that once. Okay, safety netting is very important. Again, psychosocial aspect was really fine, like I said, but again, should be in place, should be relevant. Overall, a very good consultation. Doctor, thanks so much, and that's a clear pass.